You're watching Fox 45 Morning News. All local, all morning.
All right, well, a new study says peanut exposure may be good for young children.
Yeah, why the exposure to that nut may prevent food allergies down the road. 7:52 is the time. You're watching Fox 45 Morning News. See, now I want a peanut butter and jelly sandwich. My goodness.
Children who eat peanuts earlier in life may be less likely to develop food allergies later on. It goes against years of thought, but new research shows it could actually help prevent fatal reactions. Dr. Manav Singla, an allergist and immunologist with MedStar Franklin Square Medical Center, is joining us this morning to talk about this new study. You were at a conference where this newest information was released. What did it say? What are we telling parents?
So really, food allergies have almost doubled in the past 20 years. It's really an epidemic. So in response to that, we started telling people, gosh, you really should avoid introducing peanut, egg, shellfish. You should avoid giving your kids that early in life. Well, we've turned that upside down now. We've now found that giving peanut to children who are at risk for allergies earlier in life decreases the chance of developing a food allergy. So what they did is they took kids from about 4 months of age to 11 months of age. And if they were already at risk for allergies, family history, had some bad eczema, and they started giving them peanut at a younger age. And they also followed a group of kids that did not get peanut. Well, by the time they were 5 years old, the kids that were getting peanut had almost an 85% chance less of developing a food allergy to peanut.
Now that sounds like, very concrete information, but for years that's the opposite of what parents were hearing. So what do you tell parents about how to actually do this in their lives? And because they're going to still be a little nervous about introducing something to their child, which could have, in some cases, a fatal reaction. How do they practically do that? This
has been a big paradigm shift, a big change for recommendations. So I think the number one thing is you need to talk to your pediatrician. When you have a newborn, a young child, talk to your family doctor, talk to your pediatrician, talk to your allergist, because it's going to kind of depend on your situation.
Okay.
If you have, for most children, the advice should be start introducing these foods early at age, early, 3, 4 months, 6 months of age. However, if your child already has bad eczema or is already showing other food allergies, then you should really approach that with a lot of caution and speak to your doctor first.
Because sometimes you may have to do it in a controlled setting and not just something you do at home where you don't have a medical team ready if something happens.
Absolutely. So the kids that were at greatest risk for developing a food allergy to peanut were kids that already had bad eczema and already had demonstrated a food allergy to either milk or egg.
Okay.
So egg especially. So really it comes down to your personal situation. I wish we could say it's a one-size-fits-all recommendation. It's not. But there is suggestion that if you're going to develop a food allergy, it's more likely to happen early in life, and therefore eating those foods early in life before you get the allergy can potentially be protective.
Now this is 1 or 2 new studies that have said that versus all the years of the studies that we thought opposite. So are we confident in this? Do we think more research needs to be done before we start making this shift, or go full steam ahead?
We do need more research. So this is just with peanut. And by the way, there wasn't really a lot of research that told us we should avoid introducing foods in the past.
Was just
it's kind of our gut instinct. And unfortunately we were wrong. So now there was just some research published just this week about milk, egg, and some other foods, sesame, and they looked at the same situation where they asked 2 groups of children, one group to introduce all these foods early, another group to avoid them. And that study came up with a little more mixed results. But there was an indication that kids that got certain foods at a younger age on a consistent basis, such as egg and milk, did do better.
And that's the good news out of all of this. So interesting. All right, well, thank you so much. We appreciate it. Coming up.